Good afternoon, everyone. We're going to give everyone about 2 minutes to join, and then the webinar will start. Thank you for your patience. Right. Good afternoon, everyone, and welcome to the NMG and Discovery Health Updates presentation for 2026. My name is Dominique Cortoni from NMG Benefits in Cape Town, and this session is to highlight and summarize the various options available on Discovery Health, with particular reference to the changes in benefits and contributions for 2026. Please note NMG is an authorized financial service provider, and the NMG staff are fully accredited with your medical scheme, the FSCA, and the Council for Medical Schemes to provide you with advice. As one of the largest financial service intermediaries in South Africa, we can assist with various elements of your medical scheme and provide you with an independent view and advice of the most appropriate option. I will now hand over to Darshan Govender from Discovery Health, who will be taking us through the updates for 2026.
Thank you so much, Dominic.
Go to stop sharing here. There we go. Everyone, if you have any questions, please feel free to put them into the Q&A section, and these will be answered during the session or directly after. And Darshan is going to take you through all the changes with regard to Discovery. As I say, this is the time to ask the questions. We also have Shaheen in the background assisting with the questions. So they are the experts. I'm the expert. Ask your questions. And Darshan, I hand over to you.
Perfect. Thank you so much, Dominic. I'm just checking if you can see my presentation up on screen.
Yes, we can.
Awesome. Thank you so much. Once again, good afternoon to everyone. Thank you for joining us for the NMG and Discovery Health Medical Scheme presentation this afternoon. I'll be taking you through the key updates for 2026. I think, before we get into any technical detail, I think it's always important to remind you that at Discovery Health, our core purpose is to make people healthier and enhance and protect their lives. It's something that we take extremely seriously. It's ingrained in our organizational culture and the cornerstone of everything that we do, and never really more important than during the year-end revision process. If you do have any questions, a reminder to put that in the Q&A today, and we have our team in the back end assisting with these questions as we go through the content. So let's have a look at how the Discovery Health Medical Scheme continues to provide industry-leading value. When we do a comparison with our in-hospital cover ratio versus the open medical scheme industry, we're sitting at 96.1%, significantly above the average of 90.6% within the industry. Now, if we tally that up, it works out to over 2.9 billion Rand in additional cover for our members in hospital stays during 2024. And the highest claim during this period was 11.5 million Rand, which was paid out in full. And we continue to provide exceptional access to a wide range of benefits outside the in-hospital cover. This includes over 6.1 million GP visits that we funded for in 2024, 28,000 babies born onto the scheme, with 760,000 members living with a chronic condition, 416,000 living with a mental health condition. We also saw 121,000 mammograms conducted and 209,000 prostate screenings. Now, each year we do a comparison to understand from a contribution perspective what the affordability is compared to the next 7 largest open medical schemes. But we also take into account the actual benefit. So we compare like for like benefits. And on average, our principal members are paying 12.7% lower in contributions versus the open medical schemes. Now, something key for 2026 is understanding what are my contribution increase going to be for my specific plan. Now, we have our contribution increases ranging between 6.9 and 7.9%, as shown on screen, with the Active Smart plan having a 0% contribution increase. This leaves us with a weighted contribution increase of 7.2%. Now, just on that Active Smart plan, we want to ensure that we provide medical scheme cover that is accessible to younger populations. We understand this is really key in ensuring the long-term sustainability of the medical scheme, which is why we've kept that contribution increase at 0% for next year, purely for the Active Smart plan. So each year, the contribution increases are put through from the 1st of January, and we have decided to defer the contribution increase from this date to the 1st of April 2026, providing financial relief to our members to the value of 1.5 billion rand. So as a summary view, your contribution increases will range between 0 and 7.9%, depending on the plan that you've selected. The contribution increase will only take place from the 1st of April and not the 1st of January next year, providing you with an opportunity to review your current plan and will allow plan upgrades or downgrades effective the 1st of January as well as the 1st of April next year. So please look out for communication from your financial advisors as well as from the medical scheme. We will be sending out year-end revision letters in the coming weeks to provide you with your specific contribution increase, as well as providing you with the rand amounts to make that informed decision. And when you are making that decision, as Dominique indicated earlier, please contact your NMG consultant. They play a crucial role in providing key financial advice for members choosing to review their plans during this time of the year. Remember to balance off the financial need, which is the contributions you're paying, as well as the benefit needs associated with that plan to ensure that the plan that you're selecting meets your needs from a contribution perspective, as well as from a benefit perspective as well. Now, with the contribution deferral taking place from the 1st of April, if you have selected a plan that has a medical savings account, we will allocate this amount based on the 2025 contributions from the 1st of January. Then we will increase this based on the plan that you've selected from the 1st of April in line with the contribution increases. I think it's also key to ensure that you are registered on the website and have the app downloaded to monitor your benefit balances, such as your medical savings account. We do have some other benefit updates that we are putting in effect from the 1st of January 2026. This includes supporting families after pregnancy, firstly by the Nurture at Home benefit, where we have a premature or medically complex infant that is transitioning from neonatal ICU into home that has spent more than 7 days in the neonatal ICU by providing vital benefits such as a virtual home nurse visits, as well as mental health support, virtual health coaching, and pediatrician follow-ups. We're also offering parental bereavement counseling, and this is additional support for those families, which is following failed IVF, miscarriage, stillbirth, or a neonatal ICU loss through the medical scheme benefits. From a targeted interventions perspective, providing home-based virtual care for elderly for members that are 65 years and older who are at risk will have access to a defined basket of care, including virtual consultations and virtual health coaching. Now, each year we aim to optimize some benefits, including the oncology benefits, by providing additional cover for the palliative care consultations and implementing ICON as the designated service provider network on network options to ensure quality of care from that specific provider. Now, we are looking at co-payments on the oncology innovation benefits for those biologic medications that will increase to 50% on the classic comprehensive and 30% on the executive plan. So please look out for additional communication if you are impacted by some of these changes. With regards to other benefit updates, from the Key Care Start regional plan, we're adding 3 new delivery systems in Potchefstroom, Welkom, and Kimberley. And some of the annual updates that are in place every year include the annual updates to the formulary and chronic drug amounts, as well as certain benefit limits, co-payments, and deductibles, which will increase in line with the relevant inflation figure. And for the plans with the annual threshold, these will increase in line with the relevant contribution increases. We're excited to announce a new plan series for next year. And this is really centered around young families and their unique healthcare needs. So we did some extensive research to understand, firstly, what are these universal healthcare needs? So these would be the core services like your GP consultations, dentistry, optometry, as well as what are some of the unique healthcare needs from the utilization that we've seen on our plans with the medical savings account, such as utilization on dermatology, as well as gynecologist visits, including hospital cover, because we understand that an average cost of an admission is 70,000 Rand regardless of your age, and these young families being proactive in their care. We are proud to introduce the Smart Saver series, providing unmatched value for young families, but not limited to young families. This plan or the plan series will include unlimited hospital cover up to 200% or 2 times the Discovery Health rates in hospital across the classic Smart Saver option, and providing 100% of the scheme rate cover on the essential Smart Saver plan. And the plan will include next generation day-to-day benefits. These day-to-day benefits include the risk-funded day-to-day benefits, which are things like your unlimited GP consultations within the network, as well as your dental and optometry checkups, with limits and co-payments being applicable. You'll also gain access to the personal health fund and the medical savings account as well. So providing 3 different segments of day-to-day benefits on this option for members that are interested in selecting this plan in 2026. We also looked at some of the benefit utilization and limits across a family of 4 from our classic and essential saver data over the past 5 years to understand exactly what limits would need to be in place and benefits are made available for those families that are interested in selecting this option in 2026. And as you can see, it expands choice by including 2 new plans within the Smart Saver series, fitting nicely between the Smart and the Saver series, giving you access to the classic and essential Smart Saver plan. So we've got some of the contributions on screen. This will be available from the 1st of January 2026 and will not experience a contribution increase from the 1st of April. So the 3,350 that you're seeing in place for a main member on the Classic Smart Plan will be the premium that you'll pay throughout 2026. Interesting enough, on our data that we've seen, the Essential Smart Saver, the dependent rate of 895 is the most affordable within that plan segment across the entire open medical scheme market. Moving from a new plan to some enhancements to an exciting benefit that we launched in 2025, Personal Health Pathways was in place to drive positive individual behavior change and at a population level to have a positive health impact. By driving this healthy behavior, we have seen a 5.2 times increase in the number of total completed actions across the different categories. So we're seeing more members visiting their practitioners, conducting cancer and other screenings, as well as chronic diagnosis tests. And interesting enough, we had over 27,000 members that have exercised for the first time in 2025. Now, apart from utilization, we've seen improved health outcomes. This is really key to personal health pathways. And some of these figures that we extracted show a 10% higher 5-year survival rate with early diagnosis of prostate cancer and a 28% higher 5-year survival rates with early diagnosis of breast cancer, showing a 14% decrease in admission rates when you're utilizing one GP versus multiple GPs, and a 16% reduction in morbidity when having good physical activity habits. The Personal Health Fund was also introduced as a partner with Personal Health Pathways, delivering exceptional value and flexible day-to-day cover. I was one of those members that actually utilized my medical savings account early in the year. By engaging in Personal Health Pathways, I was able to accumulate funds that I actually utilized for out-of-hospital expenses, such as going to the pharmacy, as well as having a GP consultation during flu season. In 2026, we are enhancing this even further by providing more precise, more personalized, and more rewards. I have a short video to play for you as an introduction for this in 2026.
Personal Health Pathways helps you take the next best step toward better health. It turns data and clinical science into simple, everyday health and exercise actions and rewards you for them. With millions of next best actions completed, it's becoming more precise, more personal, and more rewarding. We've now added Sleep Actions, a world-first feature that uses your Vitality Sleep Score to guide better sleep through personalized weekly goals and rewards. And we're going beyond priority health actions with health challenges, multi-week programs tailored to you, from sleep tracking to glucose monitoring. Complete challenges, earn weekly rewards, and unlock up to 1,500 Rand in your personal health fund. Brought to you by Discovery Health Medical Scheme. Start the year strong with up to 1,000 Rand in your personal health fund by completing your health check and linking your device. Then grow your fund up to 24,000 Rand through ongoing healthy actions. Personal Health Pathways is redefining personalized health. More precise, more personal, more rewarding. Your next best step starts here.
There's always excitement around this introduction video because I'm reminded of the excellent benefits that we will get from Personal Health Pathways in 2026. And one of the key themes here is around sleep and quality of sleep and the profound impact that it has on our health. Now, we can see from our sleep data that there's a 60% higher likelihood of diabetes onset with poor sleep duration, as well as a 21% higher likelihood of a casualty visit with your poor sleep duration as well. Now, with this taken into account, we're also seeing an up to 30% lowering of all-cause mortality for individuals that sleep between 7 and 8 hours. And in the hope that all of our members improve their sleep, we will see a reduction in the healthcare costs, therefore influencing medical inflation as well as contribution increases in the future. Now, sleep goes hand in hand with exercise, and we are seeing a lower bedtime variability with higher physical activity, as well as higher sleep duration and improved sleep quality for those who have a higher physical activity on a weekly basis. We are introducing sleep actions and sleep rewards, like you've seen in the video that we played. We want you to sleep well by looking at your Vitality Sleep Score, and this is a daily thing that you'll be able to track through the app itself, and you'll be able to see your progress towards personalized sleep goals each week that run between a Saturday and a Friday that follows the same process as we do for your Vitality Active rewards for your physically active goals each week. So the sleep goal will work on a weekly basis. You'll get a personalized weekly sleep goal. For example, on screen, the weekly goal here is 400 points, and your daily sleep score will accumulate towards this weekly goal. You can see in the example that we provided that on Saturday night, the sleep score wasn't as high as the other nights, as well as Tuesday, but we did recover during the week and we managed to reach that goal. You will then get an instant reward apart from waking up feeling refreshed. This weekly reward will be available. Alternatively, you can choose to bank it and utilize that on the game board play to unlock additional discovery miles that you can accumulate and spend in the Vitality Mall. Now, the Personal Health Pathways also has an enhanced view for personal health challenges, which is going to be new in 2026, providing personalized challenges, which is prioritized by your highest clinical impact. This gives you additional ways to monitor your health and improve your health across the Better Health Challenge for maybe members who are diagnosed with diabetes or high blood pressure. They'll be able to monitor their glucose and blood pressure, as well as for those who are just getting started with exercising or needing to stay active and get consistent across the exercise challenges, as well as a sleep challenge for those who haven't yet started tracking their sleep, or for those who want to achieve optimal sleep. You're able to earn instant weekly rewards in addition to that additional funds accumulated up to 1,500 Rand per adult per challenge by completing the personal health challenges that will be accumulated to your personal health fund. You're able to attempt 2 of these annually, and you'll gain access to this by ensuring that you've downloaded the Discovery Health app, activated Personal Health Pathways, and gain access to the personal health challenges in 2026. And speaking about the Personal Health Fund, looking at 2025 currently, the maximum you can earn per policy is up to 10,000 Rand. This is increased further in 2026 up to 24,000 Rand, depending on the plan that you've selected and your family makeup. We're also providing you with an advance of up to 1,000 Rand per adult on the 1st of January. All you have to do in 2025 is activate Personal Health Pathways, enable physical activity and sleep tracking, and complete your annual health check. If your employer hasn't yet hosted a wellness event that gave you the opportunity to complete that health check, you're able to do so at one of our network facilities and pharmacies across the country before the end of the year. Personally, myself and my wife have both completed our health checks, and we've activated Personal Health Pathway. So we're starting off the year with 2,000 Rand in our Personal Health Fund. We can get up to 12,000 Rand per policy by completing those recommended next best actions, and up to 1,500 Rand per challenge. And this is up to 12,000 Rand in additional value for completing these challenges across the Better Health, exercise, and sleep challenges that will be available in 2026. So that's the end of our Discovery Health section this morning. We are going to touch on Vitality. Just a reminder that if you have any questions on anything that we're discussing this morning, pop them in the question and answer section. Our team in the back end will get working on those for you. Now, Vitality, definitely one of my favorite products, because not only is it a world-class wellness program that is proudly South African created here and taken across the globe, we retain our key partners across the Get Healthy and Get Rewarded benefits. From a Get Healthy perspective, the healthy food benefit is in place, as well as the flagship gym benefits, fueling your workouts with the sports gear and equipment, as well as our exercise outdoor benefits and the cashback in miles across the healthy category from Clicks and Dis-Chem. Now, getting rewarded is definitely my favorite part. Earning those discovery miles to spend in our Vitality Mall, as well as our partner network, and utilizing the travel benefit, which is never more applicable as we head towards the end of the year to get that well-needed break. In 2026, we're introducing Vitality Sleep Pillar, and that's going to be applicable with the Vitality Sleep Score and the Vitality Sleep Awards. You're going to get that weekly goal. The Vitality Sleep Score per night is going to accumulate towards your goal for the week. You'll be able to achieve that weekly goal and get an instant reward, or you can bank that for that game board play, which is probably what I'm going to do, to try and earn additional miles, which is all powered by that Vitality Sleep Score. In addition to that, we are introducing Vitality Sleep Rewards with Oura Ring. You're able to get a fully funded Oura Ring 4 for 24 months by meeting your dynamic weekly sleep goals. So here, this is exclusively available to Vitality members in October. The Oura Ring 4 is a fitness tracking device that you're going to also utilize while you're sleeping to give you your Vitality Sleep Score. In order to gain access to the fully funded benefit, there are certain terms and conditions in place, such as having a paid Discovery Bank product like the Discovery Credit Card with specific amounts available in the overall limit and available limit in order to qualify for the fully funded benefit. There is an activation fee. In addition to the activation fee, you have a monthly amount that you would need to repay. That monthly amount is determined by the number of goals that you meet. If you meet 4 out of 4 goals for the 24 months, you will have a 0% repayment. We have a scale on screen that shows you what your repayment will be depending on the number of goals that you've met per month, and it's up to 417 Rand per month, which will be this. With the Sleep Score going live in April, even if you activate the benefit now, we're providing you with a grace period until April 2026 to utilize this device and start tracking your goals from when the Vitality Sleep Score goes live. If you prefer not to activate this fully funded benefit and maybe prefer to have an upfront discount with Vitality members and members with personal health pathways, you can enjoy up to 25% off this ordering for. This device is not available anywhere else but through Vitality and Discovery Health. Please check the app and the website for additional terms and conditions around the benefits. And you can even contact our client service center if you have any further questions or concerns regarding this. In addition to the ordering for, we're also introducing Vitality Active Rewards with Garmin. So here, you're able to get a Garmin device for 24 months, and this is based on the weekly exercise goals. So where ordering for is measuring the sleep goals, the Garmin device will be measured on the exercise goals for the week. You get up to 8,000 Rand funding for a device on Sportsman's Warehouse and Total Sports. And this is really based on active rewards, as well as the same terms and conditions around having the paid Discovery Bank product qualify. Again, if you choose not to go with the fully funded route, then you will be able to qualify for an upfront up to 25% of the Garmin device itself. Additional information is available on the website with the terms and conditions being applicable. Now, each year there's a competition internally to see which employees can reach diamond status. And we want to give you more opportunities as a member to reach these diamond statuses each year by offering up to 78,000 points to earn for a single member and 144,000 available for the family. You'll be able to earn additional Vitality points for sleeping well, eating well, getting active, as well as for completing those Vitality health checks and assessments in 2026. Remember, there is a tracker on the Vitality corporate app, which is the Discovery app with the gold and blue theme. We're able to track all the points that you've earned for any activities. It also allows you to link a fitness and a Prove Fitness device as well. So for those updates in 2026, we are expanding access to the fitness facilities, giving you access to book Virgin Active class bookings. And we saw from the expanded fitness network that our members prefer going to yoga and Pilates facilities. So we've added Book a Mat, and we've included the Garmin device, which may be fully funded. We're also introducing Vitality or sleep as a Vitality pillar with that Vitality Sleep Score. The Vitality Sleep Tracker, if you don't have one of the approved devices, such as the Apple Watch, Garmin, and Samsung devices to utilize to track your sleep, as well as Vitality Sleep Rewards and the fully funded Oura Ring 4. We've just discussed the additional ways to earn Vitality points and reach your diamond status. And for the last day today, I think it's the end of October. Unfortunately, I didn't get to earn my 10,000 limited edition game board tile, which I've tried to reach during the month of October. If you haven't yet utilized your game board play today for goals that you achieved last week, please try. It will be the last opportunity with the celebration of 10 years of Vitality Rewards to get that 10,000 miles limited edition game board tile. Perfect. We've reached the end of the Discovery Health and Vitality updates for 2026. I'm going to pause for a second and check in with our team if we do have any additional questions that we can answer live before your next section.
Hi, Darshan. Dominique. Can you hear me?
I can hear you.
Fantastic. So we've had a question with regard to the activating the Vitality on the app, where people do that. Not the Vitality, sorry, the Active Rewards, and the PHP. Where on the app do they activate that?
Okay, cool. So I think it's important. We'll start with PHP, so Personal Health Pathways. There are two different apps that we'll be referring to. The Discovery Health app can be downloaded from your App Store, Play Store, as well as the App Gallery. This is a light blue themed app. If you are already registered on the website and have a username and password, you can enter this in. When you get into the app, there's going to be a banner on screen that will allow you to activate Personal Health Pathways. It does have some information that you need to read through to understand exactly how it works. You continue with the instructions and confirming your activation. It will then generate your next best actions for you to complete. It's as simple as logging in and clicking on a few tiles to activate Personal Health Pathways on the Discovery Health app. Now, Vitality Active Rewards can be activated through the Discovery Corp app that has the gold and blue theme. And same username and password can be entered in. You will tap on the Vitality icon at the bottom, scroll down to Vitality Active Rewards. It will then provide you with some key information around the activation. A few simple clicks on tiles will allow you to activate Vitality Active Rewards and give you your weekly goals, and you can choose which goals you'd like to activate and start tracking via the dashboard.
Fantastic. How often do we get actions? So I get my 3 actions, I do them. How often would we be getting actions on the Personal Health Pathways?
Yeah, I think that's the beauty behind Personal Health Pathways, because they are personalized to your personal circumstance. For me, as an example, this year, I only had 3 actions. It gave me a specific date to complete my health action by. So the dark blue actions will give me a due date, and it will generate a replacement action based on my personal profile. So it depends on how frequently you complete your actions, it will be replaced, and based on your personalized demographics, health data, and screening information. You may have 5 or 6 actions that will replace each time one expires or you complete them. And if you don't have any health actions available, then you can wait and recheck the app if any new ones are generated. The actual exercise actions are a weekly one. So you'll always have an exercise action available for you weekly to complete and earn that instant reward and game board play, which is linked to Vitality Active Rewards. And then from next year as well, we'll include the green action, which will be your sleep action, and that will be available on a weekly basis as well.
Fantastic. And just to reiterate, I do not need to have Vitality to access the PHP?
That is correct. You do not need Vitality to access Personal Health Pathways. If you activate Personal Health Pathways, you'll gain access to a portion of Vitality Active Rewards, which is the weekly exercise action that you'll have, as well as the sleep action from next year as well.
Okay, great. Once again, guys, please put your questions in the Q&A. We'll answer them. And if we don't get to them during the session, we'll definitely come back to you after the session. So, Darshan, thank you for a very, very informative session. Personal Health Pathways is something I'm very much looking forward to, and I definitely will be scoring 100% on my sleep goals. So thank you for all of that. I'm going to just quickly take you through the plans that are available going into 2026 for us. Starting first of all with the setup of your plan. Please remember that all the Discovery options cover hospitalization. The hospitalization is unlimited on all Discovery plans. The executive plan reimburses hospital claims at 300% of the Discovery Health rate. The classic plans reimburse hospital cover at 200% of the Discovery Health rate, and essential, coastal, and key care plans reimburse hospital claims at 100% of the Discovery Health rate. Very importantly, if you have the words Delta, Smart, Key Care, or Coastal in front of your plan name, you are required to use network hospitals for planned procedures. However, in the event of a life-threatening emergency, I go straight to the nearest hospital and I am fully covered by my medical scheme, irrespective of which option I'm on. Very importantly, please note, all hospitalization needs to be authorized. The rule of thumb is 74 hours before you go in for a procedure, for a planned procedure, you have an authorization. And when it comes to emergencies, please ensure you've either downloaded the Discovery app onto your cell phone, your family know you're on Discovery, or you carry your Discovery cards. There are certain procedures on all the plans that require you to use a day hospital. It's very important, getting very important nowadays to have gap cover. Gap cover is a short-term insurance that covers the shortfall between what your medical scheme pays out and what your doctor charges. These shortfalls arise because there's no forced regulation on provider charges. Medical schemes may only cover up to a certain rand value, and your medical scheme may have co-payments and deductibles. Please note, if you are interested in having gap cover, please contact your NMG consultant. We will happily assist you with a choice of gap cover. Looking at chronic medication, all medical schemes are required to cover 27 chronic conditions. This is paid from the risk benefit and not your day-to-day benefit. On Discovery Health, members on the comprehensive and executive plans, with the exception of the Classic Smart Comprehensive option, have access to medication relating to 49 chronic conditions. Should your doctor diagnose you with one of these chronic conditions, it's necessary for your doctor to complete a chronic application form and submit this to the scheme. This will ensure that your treatment and medication relating to the condition is covered by the medical scheme and will not affect your day-to-day benefit. Each plan has its own formulary guiding members on which medications are covered in full, and co-payments may apply on non-formulary medication. It is necessary for all members to use designated service providers to avoid a 20% co-payment on their chronic medication and chronic treatment. Looking at day-to-day benefits, these come in different formats. The first is the core plan. Any plan with the word CORE in front of it offers no day-to-day cover. The Key Care and Smart plans offer day-to-day benefits through a network arrangement. This means that there is no savings account. Members need to use the network in order to get full cover. The Saver plans available on Discovery Health offers the day-to-day benefits through a medical savings account. The allocated savings available on each plan will be determined 9 times out of 10 by the name of the plan. If you are looking at the Classic Saver, Classic Delta Saver, your medical savings account is 20% of your total contribution. If you're looking at essential plans, it's 10% of your contribution. And if you're looking at the coastal plans, it's 15% of the contribution. However, the Classic Smart and Essential Smart Saver, the new plans that have been introduced, it is 7% for your medical savings account. Your executive and comprehensive options offer your day-to-day through a medical savings account, an above threshold benefit, and an extended benefit that is available on these plans. All Discovery options cover the maternity benefit, so irrespective of whether you are on a hospital plan, smart plan, or the top plan on Classic Comprehensive, you do have hospital benefits for your pregnancy and maternity. Please note, very importantly, you do need to register for these benefits, so you register on My Pregnancy and My Baby programs with the Discovery app. Let's look at your option summary. Now that you have a better understanding of the key components, hopefully this will help you choose your plan for next year. The executive option reimburses hospital claims at 300% of the Discovery Health rate, the Classic Comprehensive option at 200% of the Discovery Health rate. Both the executive and Classic Comprehensive options offer member additional 23 chronic conditions on top of the 27. This is not, however, applicable to the Classic Smart Comprehensive plan. The executive and comprehensive plans offer members rich day-to-day cover in the form of a savings account, followed by the self-payment gap and an above-threshold benefit. Please remember that while members are in their self-payment gap, they are able to make use of the extended benefit, which will provide them with unlimited pharmacy clinical consultation and network GP referred visits. Please also remember that when you are in your self-payment gap on any of these plans, to continue to submit your accounts, as this closes your self-payment gap. The Classic Smart Comprehensive option refunds hospital claims at 200% of the Discovery Health rate and covers 27 chronic conditions. Network hospitals are required for planned procedures, and unlike the other smart options, this offers a rich oncology benefit and an above threshold benefit for members. Members have access to unlimited network GPs at a smart GP with a small co-payment. All other benefits will be paid from the 15% medical savings benefit, and all day-to-day claims paid from the MSA will accumulate to the above threshold benefit. Once members reach the above threshold benefits, you have access to limited above threshold benefits that cover the same benefits as the comprehensive option. The priority members have access to unlimited hospital cover. However, there are deductibles applied to 14 in-hospital procedures. This is an upfront payment for these procedures and can be claimed back from your gap cover if applicable. Day-to-day benefit is funded through the medical savings account, once again followed by a self-payment gap and a limited above threshold benefit. Whilst members are in their self-payment gap on this plan as well, you have access to the extended benefit, which provides you with unlimited pharmacy clinical consultations and GP referred visits. Looking at the saver plans offer 5 affordable benefit options. Members have access to a medical savings account to take care of their day-to-day needs. The value is determined on the plan selected. Should a member run out of savings, they would need to cover their day-to-day claims from their pocket. However, additional limited cover is available from the day-to-day extended benefit in the form of pharmacy clinical consultations and referred GP network visits. Members on the core plan have no access to day-to-day benefits. You have hospital cover and 27 chronic conditions that can be covered. Please do note there was a question originally on the questions and answer with regard to the Delta Core versus a Saver plan. Please note that on a core plan, cover for outpatient MRI CT scans is not available. So if I need to go and have a scan on my knee next week because I've injured it, it will not be covered on a core plan. However, a plan with a savings account and a plan like a Classic Smart will cover these benefits. If we look at the smart options for 2026, the smart plan restricts members to using certain network providers for hospital and day-to-day benefits. The Classic Smart option refunds hospital claims at 200% of the Discovery Health rate. Please bear in mind that all these smart plans, irrespective of whether it's the Classic Smart, Active Smart, or the Smart Saver options, you are required to use network hospitals for your planned procedure. Members on the Classic Smart plan have access to unlimited network GP visits, limited network medication prescribed by a Smart GP and dispensed by a network pharmacy. The medicine limit for next year is subject to 1,970 per person and 3,300 per family for the year. Other benefits include an eye test, dental checkup, and a sports-related injury benefit with a small over-the-counter medication benefit. The Essential Smart plan refunds hospital at 100% of Discovery Health rate, and day-to-day benefits include unlimited GP visits, an eye test, dental checkup, and a small over-the-counter medication benefit. Your Essential Dynamic Smart and your Active Smart plans offer day-to-day benefits similar to the Essential Smart in that you have unlimited GP consultations at a co-payment of 130 Rand. Where these two plans are very different is the first is that the Active Smart, for any admission other than emergency, you will have a 7,500 Rand co-payment going into 2026. That means up front, you will pay a 7,500 Rand co-payment. And if you have gap cover, this can be claimed back from your gap cover. The other difference is on the Essential Dynamic Smart and an Active Smart. I need to contact Discovery with regard to going into hospital. So once again, please remember, emergencies, I can use any hospital. If I am using a planned procedure, so for instance, I become pregnant, it's a planned procedure, I will need to contact Discovery on the Essential Dynamic Smart and Active Smart, and they will advise me which hospital I am to go to. If I choose not to use their hospitals, I will have another co-payment added on to my hospitalization. Once again, very important, if you are looking at taking a plan that has a co-payment, please consider gap cover. The two new smart plans Discovery have introduced is the Classic Smart Saver and Essential Smart Saver. Excuse me, sorry. The Classic Smart Saver, you get unlimited hospital cover at 200% of the medical scheme rate at a smart network. This also includes risk-funded day-to-day benefits such as GP consultations, acute medication, a sports injury benefit, and a 7% medical savings account to pay for anything that the risk benefits do not fund. So please do remember with these plans, the 75 Rand co-payment on the Classic Smart Saver that I'm to pay to my GP when I see my GP cannot be claimed from my medical savings account. My medical savings account will be used for something that is not covered by my risk benefit, such as if I require fillings or extractions on my teeth. The Essential Smart Saver has similar benefits and you get unlimited hospital cover at 100% at the Smart Network. However, the risk-funded benefit does not include any acute medication. The KeyCare series offers affordable private cover through the Discovery Health Network. No savings is offered on these plans. Members have access to the following on the KeyCare Plus plan: unlimited cover for hospital admissions, full cover for in-hospital specialist, unlimited cover for medically appropriate GP consultations, blood tests, x-rays, or medicine through the KeyCare networks, and casualty benefits specifically for PMBs. This also offers you the 27 chronic conditions and extensive cover for pregnancy. Members on the KeyCare Start plan have the same benefits available as the KeyCare Plus. However, this is linked to a network GP. So how this plan works is you have a network GP and the network GP will determine which hospital you get to use. This is aimed at your areas such as where your students are. So for instance, in Stellenbosch, I would use a KeyCare Start plan and have access to the Stellenbosch hospital and the network GPs that are available there. Members on the regional KeyCare Start need to make use of a regional hospital for full cover. Please note these hospitals are different to the KeyCare Plus and KeyCare Start hospitals. So if you are looking to take any of these plans, please ensure which hospital you're going to use. The KeyCare Core plan is a hospital plan and only offers a limited out-of-hospital specialist benefit. There is no GP consultations or any other cover with regard to that. If we look at our rates effective 1st of April 2026, please bear in mind from January, you'll be paying the same rates as 2025. As Darshan mentioned, these are your rates for April 2026. You will have the option of changing your plan 1st of January and 1st of April. Please note your savings account will be topped up from the 1st of April. So your savings is a percentage of what you pay for everything else. So therefore, it will only be topped up when the higher rate comes in. And if you are looking to change your option and need assistance, please contact us with pleasure. Looking at the KeyCare plan, these are the income banded plans. It does mean it takes into account your monthly salary. So if you change income bands, you may find that your KeyCare Plus or KeyCare Core income band will change with regard to your rate as well. Vitality updates. The vitality updates, as Darshan went through, one of our new benefits is the sleep. Please also note there's been some changes on the Eat Well and Get Active benefits, and health checks and assessments on our 25,000 and 50,000 points. Your vitality contributions will change effective 1st of January, so not 1st of April. These will change 1st of January, and you have access to Vitality Active or Vitality. Okay. This is NMG's complaints procedure. Please remember, we've gone through the basics here. Your medical schemes rules still apply. And if you do have any issues, please contact us at NMG. If you don't know who your consultant is, you are more than welcome to pop an email to the chat or to the Q&A. Pop your email address and I can find out who the consultant is and get them to contact you. Shaheen, are there any questions?
Dom, there's just one question. If we want to change plans, by when do we need to do this? So when is NMG putting that restriction on them?
Okay, so from your company's perspective, we normally say members need to change their plans by the 30th of November. Only reason for that is to make sure that all the changes are done before you go on leave. Also, for instance, if I am moving from a KeyCare Plus plan onto, let's say, a Coastal Saver option, my plan is not noted as a Coastal Saver, but on my membership card as Key Care Plus, it does state their Key Care Plus, so I will need updated cards. However, with Discovery, you can change your plan up until effective the 31st of December. You can start doing online option changes by the 7th of November, so you can do that on your app. Alternatively, there's an option change form you can complete and send through to your HR. So we would prefer to have all the changes by the 30th of November. However, members do have effectively until the 31st of December to change their option. Okay. Thank you once again for all your time. Darshan, Shaheen, thank you very much for your time. I hope this was an informative session, and I have a fantastic day.
Cheers, Dom. Cheers, Darshan. Thanks.